encourage possibly countries to start taking more of the vaccine coming in.
But by the time that happens, it will be a couple of months, before we get a significant amount of doses. You talked about people wearing masks, social distancing. They haven't been doing it, hence the infection rate going up. So what, in a practical sense, do we see the containment measures becoming stiffer rather, and more restrictive? We know the president is going to make an announcement on the curfew very, very soon. What can we do in a practical sense?
I think if you look at it in terms of this, you have to balance about the economy, and also you have to balance on the health of the population. And I think that's what puts the president in a very difficult situation. And us also are in the same boat, because we have to tell him what is right to do, what are the scientific merits of what needs to be done. And if we start seeing the surge going up, then you cannot afford to lift the controls. You have to more or less be stricter, because at the end of the day, health is what drives the economy. Without healthy people, and if we start losing more of our population, then that is not going to be very easy for us.
Certainly, and on that note, Archbishop, let me bring you in. Churches reopened, of course, under some containment measures. We've seen the infection rate go up. What kind of precautions do you see churches taking now with this new information?
Thank you very much. First and foremost, I think we never knew how the infection spread would react or how it would behave. At the beginning, we always thought it would be just one wave, but as we can see, it has a different dynamic. But I think, as we have seen, the second wave was a bigger wave, and it hit us quite a bit. But let's say during that time and up to December, most of the places of worship, of course the churches included, had about 95% compliance levels, which means we really did we performed greatly as compared to the public square, public space, and of course, without to mention the political gatherings, which were really almost without any compliance. So we have performed very well, and I think I want to also express our appreciation to all the faith leaders for the great effort made. However, we have noticed in the January, February, there's a bit of relaxation, perhaps influenced by the behavior outside in the public square. We believe that even with the statistics we are having now, we are in a much better place than we were, say, in December, in November, and we are watchful and vigilant in case that was to change the behavior and the spike become rather big. And as we said in our guidelines, we are ready to review as the situation arises and the circumstances change. But as we are now, the Interfaith Council indeed have said we're in a position as continuing with the same strictness and restrictions in our places of worship, but we can advance now to the phase 3, where we continue with the same advices. However, the numbers, as we have seen, would vary slightly. But in principle, we are watchful, and that is our role. And we tell all the peoples, the churches, in our churches, even in the mosques, to be still extremely vigilant, to observe as far as possible all those measures that our doctor has just mentioned now.
Dr. Ogutu, let me bring you in here, because there's a lot of concern beyond the rising cases on the new variant and its characteristics. Is it a point of concern in terms of maybe how infectious it is, what kind of symptoms it causes? In your view, what should people be looking out for?
Thank you very much, and that's a very pertinent question, because as we have new variants, and this we have seen with different viruses and even parasites and even bacteria, because every living animal will always strive to survive beyond the barriers or the environment that has been created hostile to it. And that's what is happening with these variants. So, and you find that some of the, when they change, some of the new variants that come up might not be very fit, and you might find they might not be highly infectious, they might not cause more symptoms, but also they can move the other way. They can be much more infectious, possibly give more symptoms of severe disease in people. And these are some of the things that now we have to be very vigilant to observe and see how the body reacts to this new variant. We have seen in places like South Africa and the UK where it has become more transmissible, the new variant. But these are things that are going to change. These viruses, being just single-stranded viruses, their gene pool is very versatile. And whenever they are stressed, they are likely to change. Because as we put more control measures or treatment or vaccination, then this can easily happen. And this being new, these are things that we have to observe and really advise on what measures need to be in place, and also see what we need to do. If possibly becomes more severe, then we need to make sure we have facilities that possibly can support people through the sickness. And that's going to be fairly costly for health systems that are fairly stretched like ours. If we get in more people going to the ward, because we know in the last 1 week, basically our ICUs are packed to capacity.
They are, and that has been a concern.
That's a big worry for all of us.
Certainly, you know, when we look at the vaccine, which at least is a preventative measure that can be taken, you were vaccinated yesterday.
Yes. And
there is concern about how much information has been shared about the vaccination itself. We know the doses are here, but what does the Oxford AstraZeneca vaccine actually do, its efficacy, in terms of keeping the host safe once you are vaccinated? You know, if we're trying to explain in layman terms, what does the vaccine actually do? What would you tell an average Kenyan?
Thank you very much. And the AstraZeneca vaccine is much more protein-based, and it is carried on a virus vector that actually choose, because this virus vector has been used for development of other vaccines before by the Oxford University research groups for quite a number of years. So it's something that has gone into people so many times, and that's why they were able to make the construct pretty fast. Immediately the COVID virus was sequenced, they were able to get that. So basically the vaccine stimulates the body to produce antibodies, and those should be able to fight the virus the next time somebody is exposed to it. And that's why we are talking of, if you listen to some of the things, they talk of antibodies that will neutralize the virus whenever it enters the body. And that's the major mechanism. But there might be other mechanisms that it is acting on to prevent the virus from establishing itself into the body.
And we still don't know what it does for someone who previously got the disease, recovered, you built up antibodies, and then you're vaccinated. So we don't have information on that just yet either.
That is information that possibly is going to be available pretty soon.
Okay.
Because there are people working around the clock on that. And a number of studies are going on in the lab, getting blood from these people that have been vaccinated, who have been exposed. And I think this data that we are going to have, this is a new disease, and we are running as we try to possibly set up everything.
And it's a bit precarious considering that, you know, people will be getting vaccinated. Would it require having to do maybe an antigen test before you're vaccinated to ensure that there's no issues?
Well, there have been no issues. I don't think there's any issues that if somebody has been exposed, possibly they are going to react differently to the vaccine. And I think we might know that as we get more data from those who have been exposed before that, who are known that so and so suffer the disease. And also a number of diseased entities, you realize that if you are able to go down severely with the disease, then chances that you didn't mount enough antibodies to protect you are high. So you might still not be protected. We still don't know that how often people are going to be reinfected even after they had the initial infection. So these are things that's why we tell people, take the precaution, err on the side of possibly overdoing it to make sure that people are protected.
And the irony is you're a Catholic doctor who got the vaccination. You know what some of your colleagues have been saying in the media about it. What prompted you, you know, of course, to take this step, which says you trust the science?
I can say that possibly I trust the science. I've been around vaccine development for almost 25 years. Mm-hmm. And I've been watching the space for developing this vaccine. And I think the science is very clear that the vaccine is efficacious and it is safe. By the time we are now having this vaccine arriving in Kenya, Kenya is not the first country that is possibly doing public vaccination. This vaccine has gone into more than millions of people already. And even by the time the license was given for emergency use by the UK Health Authority, we already had tens of thousands of participants in the studies that have proven that the vaccine is safe and can be administered to people with no side effects that are beyond what has been seen with other vaccines that are currently in use.
Archbishop, let me bring you in because we know earlier this week you came against an advisory given by the Kenya Catholic Doctors Association and said that in principle you support this vaccine. We know in the past oftentimes faith and science don't see eye to eye when it comes to such issues, but you decided to at least come out and vocalize your support for the vaccine.
Thank you. First and foremost, even on this area, we need to understand what has been the Catholic Church reaction to medical practices or procedures, which we always assess and look at the ethical value of those interventions vis-a-vis the technical information that we get. And that's where the Catholic Church normally has a stand on certain vaccines that may have been doubtful, would want to make sure they're not in their ethical content or their safety, and also in areas where other procedures, e.g. in vitro fertilization or other like this, may be not ethical because of other issues that are studied at depth. So normally that is where the science and the faith interact, that it is not the faith that seems to impose on the science, neither the science which seems to want to as well put or impose on the faith whatever position. It is an interactive process. They are not conflicting, but they are mutually assisted. So in this case, however, the issue of the vaccines was actually proposed by Pope Francis as a reason to study their ethical situation. What is their ethical stand? And after the study involving many doctors and scientists, on 21st of December, a certain moral opinion was given on these vaccines, saying that they are ethical, that they are legitimate, and it's right, but must be voluntary. This was a very clear mandate or very clear pronouncement on the morality of this particular vaccine, without, of course, excluding the fact that each vaccine, as in all times, each batch should be tested just in case there may be other issues that or matter that are not safe or may bring certain negative effects. And that is the technical side. And in Kenya, we have a committee that involves several people, and I think even Dr. Gutu is in that committee, that checks and makes sure that they are safe. But for this particular case, the pronouncement by the Catholic doctors unfortunately did not in any way engage the Catholic Church as the bishops. It is the bishops who determine. After that study, and we are looking forward to a more extensive statement by the Catholic bishops. Once we have started this situation a bit more in depth through our chairman, Archbishop Philip Anyolo, where we will articulate many issues and even some of the issues that may be perhaps doubtful. But the Kenyan doctors, Catholic doctors, who is a child of the Bishops' Conference, the doctors acted out of order and made a declaration, which is their opinion. And maybe there are some merit-worthy points they brought, but they were presented in the wrong fora and without having deliberate consultation with the bishops. It's only the bishops who can give the mandate of the ethical content of be it a procedure or the vaccines. And that's why, while we wait for the more extensive statement from the Catholic bishops or the Kenya Bishops' Conference, Kenya Catholic Conference of Catholic Bishops, we can safely say that they are, it is licit, it is ethical, it has no ethical issues, and that voluntarily people can choose to do so. Holy Father Pope Francis has been vaccinated, and the Pope Emeritus, Pope Benedict, has also been vaccinated. So there should not be any fear on that line, but being vigilant for each one of those batches. Besides the Catholic Church it has been at the forefront in vaccines, in the vaccination in this country. About 30 to 35% of the vaccination in our country, Kenya, happens in Catholic institutions, health institutions. So we cannot be opposed to vaccination. We are just vigilant that none of the vaccines or any procedures should be ethically wrong.
And as you mentioned, Archbishop, this is a voluntary process. There's a tweet here from Henry Mulumba, who's watching the interview, saying, "I'll be the last to get the vaccine." And, you know, you can understand from the perspective of some Kenyans wondering, what is this all about, Daktari, in terms of how long the vaccine will last? Is it something that we'll have to take every year, like the flu vaccine, for instance? You know, and what are some other risks to look out for? Because it's still being tested and it's going through trials as people are being vaccinated. It's a very interesting process. So, and really is a step of faith to take something like this. What do you say to a skeptical Kenyan?
I think, thank you very much. I think this, for a skeptical Kenyan, what we can assure them is that the rigor of evaluating and monitoring these vaccines as they are developed and even as they are being deployed is quite one thing that everybody is looking up to. Locally, we have an independent safety committee that is currently out there looking at any reports that will come from those who are vaccinated to really see if anything happens. Is it related to the vaccine or it is not? And if it is related to the vaccine, they will have to determine how that happened. And that will have to be fed back to the manufacturers to make sure that if we see some rare things happening, then this might totally change the way people use the vaccine. So for any skeptics, nobody is taking this lightly. By the time the government agrees to have this vaccine rolled out, all checks have been put in place, and this is being done in good faith. And also the manufacturers, vaccine development is one of the places where you don't want to make any errors because you are giving it to healthy people who are not sick. So you have a very low, you don't even want to think of anything happening that possibly there was an oversight or that something happened. So this is something that they should be reassured that people are looking into this, and there are government machineries and there are independent entities that are also looking at this and able to possibly inform the Minister of Health so that if there are any glitches, then these are going to be possibly sorted out. Okay. Some of the problems you have seen with vaccines before have not been related to the vaccine itself, but the procedures around the vaccine. Did you store it properly? Okay. You may have possibly broken the cold chain and the vaccine degraded, and then you end up with a reaction, or the process of administration was not done properly. These are some of the things that possibly cause some of the severe effects that possibly has been seen before.
And speaking about the administration process of the vaccine, for instance, AstraZeneca, it's a 2-dose vaccine. So what if I take the first one and miss out on the second one? You know, are there any issues that could happen with that?
The main issue is that by the time we're settled on 2 doses is that by the time you get the second dose, then that gives you a booster response so that you generate more antibodies that are more protective. There are people who, by luck, because all of us are different, some people possibly within the first vaccination might possibly generate enough antibodies, but that doesn't happen to everybody. But we are looking at what is likely to happen. And that's why we would encourage anybody who has taken the first dose to make sure they get their second dose. And also that's why the ministry is ensuring that there are enough doses to cover those who have already taken the first dose so that people don't miss. Because we want to make sure that those who get it get the protection and possibly the cost-effective effect of the vaccine at the end of the day.
All right, Dr. Ogutu, we have to leave it there. Thank you so much, Archbishop, as well, for your insights. Fascinating information coming out of this vaccine. Of course, a lot more questions will be coming up as we progress with this process, and the government continues with vaccinating more and more of the population. Thanks for watching. Let's take a short break here on Citizen Weekend. Sports news coming up next.